So this is an adapted algorithm that helps us understand the flow of testing for thyroid issues. And there's a lot of detail here. I'll highlight the most important things. If we suspect a need for thyroid testing, somebody's got some of those signs and symptoms that we talked about earlier, we would start with a TSH test. And that TSH value would then tell us, is somebody dealing with low TSH or high TSH? And if it's low TSH, of course, we know to suspect hyperthyroidism. And we know we might want to do a follow-up test with T4 and then potentially some T3 testing. And we see that a little further down the chain. Oftentimes we'll do them together. A little bit more recently, the free T4 is coming into treatment algorithms as the first test to do of the two. And then if it's abnormal, we'll test the other ones. But we also know that if it's a high TSH, we're going to suspect low thyroid function and test the free T4. Again, we can follow that up with some T3 testing there if we need to. But once we test those, in blue there at the bottom, we've highlighted the most common issues, and those are the two cases that we saw. And then we can make a little bit of a special note when we look at other reasons for low TSH here and other reasons for high TSH here. Sometimes thyroid issues get a little bit more complicated and they're not a problem with the thyroid gland. There's a problem with the pituitary or even the hypothalamus, both glands in the brain. And those are very rare, but important to realize that if you are dealing with a thyroid issue that isn't fitting with the lab test results, or you have a patient, if you're a healthcare practitioner dealing with thyroid values with a patient that aren't fitting the usual values, there are some outliers, some unusual situations, and usually a naturopathic doctor, a medical doctor, an endocrinologist would be needed to kind of help navigate those challenges. Most of the time, though, we are seeing what we have highlighted in blue there and the two that are demonstrated by the two cases that we talked about.